tips for both genders is Dr. Andrew Stanton from Southwest Medical, part of the Optum Network, the sponsors of this segment. Doctor, thank you for being here today.
Thank you very much for having me.
The stats are interesting that they show that men do have a shorter life expectancy compared to women.
They do indeed, actually. It's interesting that you say that. So really common knowledge, I guess, is that men have a shorter life for several obvious reasons, if anyone's got any boy children, of course, right?
Right.
That being said, men on average live about, in the United States, 76.2 years, women about 81.8. And that's a pretty big discrepancy between the two of them. I mean, that's a 5-year difference.
It
really
is.
And a lot of that is because, well, men in general, we don't necessarily take as good a care of ourselves as maybe we should sometimes.
And is it possible that men don't handle stress as well? Oh,
very, very true. You know, mental health is something that's obviously a hot topic in the United States today, and I would argue that that's something that is really very important for men in particular. A lot of times men don't really feel comfortable, I guess, in maybe talking about their feelings or things like that, maybe because of how it is that they were raised. And so mental health is something that's incredibly important, and if you don't have the appropriate ways to handle stress, then maybe you look to some of the bad coping mechanisms, you know, things like alcohol, poor sleep, anxiety, that may not necessarily help you too much in terms of having a long and healthy life.
Right, just push those feelings down.
Yeah, exactly, right? Don't let them out.
I was surprised to read the stats, the causes of death, and in the top 3 now is COVID-19?
You know, I don't have any numbers in front of me, so I guess I can't really give you a solid answer on that one. I mean, COVID is definitely still out there, so obviously please stay safe, get vaccinated, you know, do the appropriate things to really kind of avoid any unnecessary infection, right? But, you know, in terms of overall health in general, what we really look at is preventive measures. And I'm a really big fan of an ounce of prevention is worth a pound of cure, right?
Sure.
So, you know, things that you can do actually, men and women in particular, actually, according to the American Academy of Family Physicians, we recommend about 150 minutes of exercise a week. That's 2.5 hours. It doesn't have to be 2.5 hours in a row, right? It can be 10 minutes here, 10 minutes there.
Sure.
You know, vigorous exercise, brisk walk is something that's really simple to do. Slight bit of weight training. Taking your dog out, you know, just kind of getting the blood pumping. It's a really good thing.
You mentioned resistance training or weight training, and I've heard that that is an especially good way to combat bone density problems and other things.
It is. Actually, it's one of the recommendations that we give in battling bone density problems, which is something that plague a lot of older adults, and weight training in particular. Now, I'm not asking people to go out and join an Ironman triathlon or I guess become a Mr. Universe, so to speak, right? But it is a pretty important thing in terms of even just a little bit of weight, you know, over a short period of time is something that can definitely show some benefits in terms of maintaining bone density and making sure that you don't end up actually with brittle bones.
Dr. Stanton, thanks so much for being here today. Great tips and great information. Really appreciate it.
Thank you.
And thanks again to Southwest Medical for sponsoring this segment. They have locations across Nevada. If you want more information, call that number right there, 702-877-5199, or visit that website. We'll be right back.